When you use psychotherapy or you are thinking of starting a therapeutic path, expectations are quite defined. One of the questions that is most often addressed to a psychologist at the beginning of a path is if psychotherapy works and when it works. Most people expect a linear path and almost totally independent of themselves. The most common idea is the one that is enough to see a psychotherapist, make some chat, and after a certain number of sessions almost magically healed. This vision of psychotherapy, which is very common, is influenced by the way we consider care in our culture. The reference model, in fact, is that of medical care. When I am sick I go to the doctor and these, after one or a couple of visits and some investigations, will include the problem and will prescribe the right drug that will heal me. Unfortunately, or fortunately, psychotherapy is not a pill, and care in psychology has very different aspects from medical care. However, in reality, both share at least a fundamental principle. Without some form of collaboration on the part of the patient it is very difficult if not impossible that the care works. Psychological therapy, a path of which you are the main actor. Psychotherapy is a path, all therapies, moreover, are, including medical ones, but whose results are not always predictable in a linear way. The reason is quite simple and intuitive. A discomfort or psychological disorder is always a complex fact and 1,000 facets. In no case, in fact, is it comparable to physical disorders such as a headache or sore throat. In practice, the factors that determine it and that can influence the course are often many and only partially predictable. Certainly also in psychotherapy you can make approximate estimates on the success or duration of a path. However, they are almost always estimates that have a general value and that can rarely be applied directly to the specific path of a certain person. This is because, as already mentioned, the individual variability is very high and is much higher than, for example, to a medical treatment. To make a medical comparison with physical pathologies, we can talk about any psychological disorder as a complex discomfort for which doctors pronounce the famous phrase, "Let's see how the patient responds to therapies." There is no pill in psychotherapy that with 1, 3, 7 administrations can guarantee a certain and faithful result for expectations, because in psychotherapy the main actor is not a drug or a doctor who works but is the patient himself, and the main tool, rather than the specific technique, is the therapeutic relationship. How to understand then if psychotherapy is working? The psychotherapeutic path is based on the alliance between the patient and therapist. To be clear, the therapist will never be able to exercise who knows what an absolute influence on the patient's mind so as to change it without even noticing it. It is the relationship between the two parts, as well as the depth of this alliance, the key that opens the doors to a change that must take place by the patient's decision. In other words, the patient takes responsibility for self-exploration, guided or oriented by the therapist, discovering the knots or personal obstacles that prevent a full and happy existence. When psychotherapy does not work, the first to notice it is generally the therapist. A good professional understands if the patient is encountered difficulties in achieving his goals and analyzes the situation to understand if something in the alliance with the patient no longer works and what aspects can be improved, even confronting the patient himself. When will the psychotherapeutic path bring results? As already mentioned before, the path is not immediate. The patient over time will begin to feel a series of improvements and greater well-being that can attribute to psychotherapy. However, it is important that these improvements are stable over time and not momentary. In addition, it is essential to confront the patient so that it can reconstruct which different attitudes and behaviors has adopted to produce changes. Some people tend to leave therapy to the first improvements, thinking they no longer need it, and then return to the usual conduct due to an incomplete therapeutic path and of which they attribute responsibility to the psychologist rather than themselves. It is important to be very clear with their patients, it being understood that no one can be obliged to continue a path that prefers to interrupt. It is the duty of the psychologist to clarify whether and to what extent the often unilateral decision of the patient can weaken and therefore frustrate the results obtained. Giving timing to understand if psychotherapy is working is not easy. Obviously, a couple of weeks are not enough for a change, even if in some cases from the first session it is possible to perceive important relief. However, Within the first October 15th sessions it is generally possible to feel a significant improvement in well-being, which begins to become more stable and is also perceived by the people who live with and or around the patient. To understand if psychotherapy is therefore working, therefore, the most useful question to ask can be, am I, as a patient, actively collaborating with the psychologist for my well-being? This is probably a good start for a therapy that works.
Up to now I have finished my video. Don't forget to register for the channel. I wish you good luck. Until we meet again.